advanced domestic health financing, enhancing access to healthcare services in Kenya.
One, just to appreciate the support coming from AFIDEP within the four facets. One on the evidence generation that within AFIDEP we've managed to do some data that we are using for advocacy, which now links to the second one where you are looking at the issue of accountability as well as advocacy mechanisms. Then on the other one on capacity development, and I think more strength on financing, budgeting, and as well as planning, looking at this in an integrated approach, not just from policy perspective, but pushing it down to planning. How do we finance, then monitoring in what we call a One Health approach. The fourth one is on technical assistance, where yourselves and our team have managed to do investment cases. We just been thinking around health investment bulletin, which is the first in the sector, where we'll be now collecting this information. So I could say that from where we sit, there is a massive support from AFIDEP. And one thing I like with this support is actually tailored to clients' needs, starting from the AWP and picking the pieces. So the support is aligned to government agenda or priorities within AWP. Yeah. So during the enactment of the laws, AFIDEP came strongly as a partner, where one, you see, for us to discuss an issue, you have to first start on where are we. And I think with the support of your team, Rose, Jackson, Mary, and Violet or somebody. Yes, there has been a massive collaboration in terms of one, getting the data right. This is a country where we've seen that there is a lot of investments, but this does not translate to the improvement of health outcomes. So the first step before you identify a problem is, what data do we have? And does this data support policy? So you can see that currently we are spending about 5.6% of the GDP on health. But if you look at the domestic resource, we are talking about 2.5%, including pooled resources, that is social health insurance funds. So when we were developing the laws, the first step was to take a step back and document. So there is some documentation that were done jointly with the MOH, where we've tried to analyze and document how much the country is spending from domestic resources, how much is being allocated from the national level, from the counties, so that as we push the agenda, one, we have the data. So your team came, so not just the technical support, but also financial support. They were involved in the costing, development of the costing protocol, the costing of level 1 to 4 services, and overall in terms of even development of regulation. So I think it was a very good collaboration, and also a timely one.
The Advanced Domestic Health Financing Project supports the government of Kenya to realize universal health coverage through increasing domestic investments in health and promoting efficient utilization of health budgets with a focus on primary health care, girls, and women's health.